You are watching the DocTalk Show. The DocTalk Show profiles Uganda's healthcare sector. On the DocTalk Show today, we profile the Chirudu General Referral Hospital. Sticking out like a marvelous concrete jewel is the now famous Chirudu General Referral Hospital that came in handy when Mulago was undergoing renovation. It is located in the neighborhood of Buziga Hill in Machindia Division, and it cost a whopping 37 billion Uganda shillings, thanks to a government that is evidently committed to the health of its people.
Initially, the site was a small health center but the government of Uganda secured funds through the African Development Bank and upgraded the health center into a referral hospital status that you see today. We moved in here initially as a department of Mulago Hospital, but decision has been made that now this is a fully fledged independent hospital, effective last year, May, but the full vote status has been granted from May 2019. Chirudu Hospital is located in Machindia Division. It is run by the Ministry of Health. Previously, it was run by KCCA, but currently it's under the leadership of the Ministry of Health. Clinical services, we do offer various clinical services to the community. We also offer research and training. Various researches have been undertaken in the hospital to basically address the health challenges our communities face. We also work as a training facility for Makerere, St. Augustine, and other tertiary institutions that train health workers to address the health needs of this country. So these are the key areas Chirudu undertakes. The Department of Internal Medicine has got subdivisions. It has got, the divisions are rated according to the body. So we have a division that looks after your brain, we have a division that looks after your lungs, called the pulmonology unit. It has a division that looks after your kidneys, called the nephrology unit. It has a division which looks after your blood, called the hematology unit. So all the areas of the body are addressed in the Department of Internal Medicine. We also have the Department of Surgery, which mainly has burns and plastic surgery. This is the only unit that receives burns and plastics cases in the country. It has a team of about 5 specialists that undertake this service. In addition to that, we also have the department which looks after the eyes. We have the eye clinic, we have the dental clinic, we have the maxillofacial area. Most importantly, we also have the emergency department. The emergency department is an area where all patients who present with emergencies are eventually brought. Various emergencies are usually attended to in this 24-hour service. The first point of referral for a patient who comes from all over the country will be Chirudu Referral Hospital. So this has been created as an extra sieve to limit the number of unnecessary referrals to Mulago and allow Mulago do its super specialized services. So as Chirudu, we are definitely well positioned for that. We have undertaken trainings for various staff to take on this assignment. Chirudu Referral Hospital is a 24-hour service care. And why do we do that? Because the diseases don't make appointments. People can fall ill at any one point in time. So we have a 24-hour emergency area that you can report to anytime. And one thing that we pride about, with all the challenges that we've faced, we have never got any complaint that I went to Chirudu Hospital and never found a doctor on duty. We have doctors on duty all the time. And we have strengthened this by providing accommodation to our doctors right within the hospital. You'll see right behind the hospital there's a complex that houses some of our staff that are on duty 24 hours. We also want to thank government for the fact that it is putting in a lot of money to offer the service in here. It's not a simple activity that you can undertake. Indeed, we face challenges of umeme, we get power outages, but the beauty about it is that as a hospital, we are rarely affected by that because we have 2 standby generators and they are automatically turned on, that many times even our patients never know that the power is gone. It is those of you who are near the generator that know that, oh, it's now the generator running. So we have 2 standby generators. Very expensive to maintain. It also requires a lot of commitment to put funds into running the generator. The other challenge, of course, that we've had in the past that I'm sure many of you have heard about was the issue of handling our wastewater, which right now we are handling. It's no longer an issue, it's no longer in the news because there's no more wastewater flowing outside. And we have been initially getting our oxygen supplies from Lago, but recently we have an oxygen plant situated within the hospital. It is running 24 hours and it's able to give us oxygen supply to our patients who critically need it. We also need to recognize the issue of the medicines and supplies. Medicines are supplied through the National Medical Store. What government does, it gets money at every beginning of the financial year and puts it on the hospital account under National Medical Stores. So it doesn't come to us, it goes to National Medical Stores. And as a user unit, all you have to do is to continue ordering the supplies, and then they draw down from your account.
You are watching the DocTalk show.
So all these prevention methods are available to you. So the onus is on you to make use of them. All right? Take your children for testing in case they're feeling unwell. You will get the treatment free of charge at the public hospitals or subsidized at the private hospitals. Ensure you use an insecticide-treated mosquito net and use indoor house spraying or insecticide paint, which is now available in the country. So we thank Dr. Pigo from the Ministry of Health for giving us this elaborate discussion on World Malaria Month. And we hope to see you next time on the DocTalk show.